So if you can see my scalp pretty easily from most areas.
It could be an emotional stress or a mental stress. You don't necessarily see the hair fall immediately. You see it after a period of 2 to 3 months of the stressor being introduced into your life. Hair has 3 different stages: anagen, catagen and telogen. Treatments are aimed at moving this hair from a falling phase or a resting phase back into the growth. The concept of, okay, we can lose 50 to 100 hair a day for a small period of time in the year, that's okay. But if that's a consistent fall that you're going to see, you will eventually thin out. There's also this whole concept of female pattern baldness or familial or genetic baldness, which we see more commonly in men. So if you've got a family history and if you're very genetically prone to developing thinning, it's better to intervene a little earlier so that you can restore a little bit of the volume. Now, regarding the treatments, for me the core always remains supplementing with the correct nutritional supplements, replacing if there is any kind of deficiency in the body, and giving you topical solutions to apply on the scalp. There are a few interventions which you can undergo at a dermatology clinic. The most common, popular and probably the safest treatment amongst all is something called PRP or platelet-rich plasma therapy. We take your blood, we centrifuge it, we extract all the growth factors and we inject it back into the area of thinning. What do the growth factors do? They help to reverse a bit of the hair which is sitting around in the resting phase. We push it to grow a little more and will probably nourish the hair enough so that they become of a better quality. It's not something that I've done my PRP, 3 weeks later I've got fantastic hair. So there is collaboration, there is a bit of work that you have to put in terms of diet and exercise. There is obviously correct expectation. You will see results depending on how severe the stress level was or how much it has affected the follicle. It can take anywhere between 4 to 12 weeks for you to start seeing a reduction in the hair fall. The PRP will give you a bit of regrowth. There will be an improvement from status quo. You're not going to be where you are.